take care of everything else because I have all those board certs, and I'm involved in the case. That's my baby. That's my patient. I'm the wound care specialist, but I did the direct admit. So I'm going to get involved in primary care. I'm going to say, hey, we don't have a hemoglobin A1C. Hey, the sugar's not controlled. Hey, the surgeon this. Hey, PVD, whatever. Okay, next. Diabetes is very costly. Next, we talked about that already. Non-viable tissue. Everybody gets really excited about cutting into this. This is usually black dry hard eschar. Do I cut into this? Exactly. You see my stuff. We don't cut into that. We score that. Score that. Put some enzymatic debrider. Give it a little time. Lift the edges. Make some holes in that so it can get in there solito. All on its own. You lift the edges, cut, lift the edges, cut. It takes patience. Okay? Especially, please don't cut this off on a heel. You have no more tissue left. Leave it alone. Have we healed out black dry heels? My stuff is like, yes. Yeah, that's unheard of. Black dry heels don't heal. Gracias a Dios. Next. You do have to get rid of non-viable tissue, just not, there's a process to doing that. I kind of told you how. This is an infected wound. Dr. Farias touched a lot on biofilm versus colonization. Yes, sir.
On the previous picture?
Yes.
So you cut it up and then eventually it's removed?
Absolutely. So let's go back to the other one.
You just don't?
No, you don't. So let's go back. Okay.
Do some people just?
Do some people, do most people just because, sorry, but they're debriding.
Okay.
And so they'll go and they'll, oh, I have a clinical indication to remove the dry black eschar. Let me just chop it all off. Okay, hold on. Have you checked the revas? Does he have flow? Is he on vitamins? Can he offload? Does he have family to bring him in? Is there a bone under there? Have you done an x-ray? What if he has osteo? Do you know that I really find that this is God's protective mechanism so you don't get more infections? We do this a lot over bones. I really feel like black dry eschar. You see a patient with black dry eschar, it's a stable wound. It's dry. Then you see somebody debride that, and all of a sudden they have full-blown osteo. They probably had osteo underlying, but all of a sudden they have a full-blown infection that went all the way up to the knee because somebody cut that off. And I say that he's not very bright. Just like this man that's not an MD and clearly not a surgeon. And then they all get offended. He's like, I don't know anything about this, but why did they put that in there? That's like old school surgery. Sticking drains. It's a foreign object. You gotta take it out. It gets more infected. Anyway, whatever. You're supposed to open up that. If you have an abscess, just open it all up, clean it all out, back the heck out of it. Do a flush. Like, no saben. Guys, we're imparting knowledge. I don't know everything, but I'm always learning. It's tiring. It's exhausting, but I'm always doing it. Right? Okay, next. So yes, so we score it, tic-tac-toe it. That makes holes within the eschar. We lift. I always kind of outline the edges with a scalpel, make a line, lift it, so that way they can put the enzymatic debrider over it. Usually I'll use some hydropheric blue, and that hydropheric blue also does some mechanical debridement because you take it off dry. And so all of that is lifting. Patience. I need to see you every week. My new protocol, I'm sharing it. I'm not stingy with my knowledge. I front load the visits. I'm a nurse. When I was doing home health, I would front load the visits. 1 day 5, 2 week 1, once a week. I front load my wound care visits. You're a new patient, you're going to see me 5 straight days, Monday through Friday. Why? I'm going to make sure you have a home health nurse. I'm going to make sure you got your antibiotics. I'm going to make sure you picked up your medication that's very expensive. Make sure that you, I'm debriding a little bit at a time. Maybe I need to score you. Maybe I need to cut a little bit of the black off. Maybe it just depends. 5 straight days, I make sure I do an ABI. I have an ABI machine in my office. Make sure I do an ABI on you. Make sure I send you to a revas specialist. Make sure you sign infectious disease. All of that takes time. 1 day 5, daily for 5 days. Next week, twice a week. Take care of more issues, then once a week. We have a patient that we healed that, and I don't think I put it up. She was from California, and she came because her sister brought her because I'm primary care for the sister and the husband. And the sister knows I do wound care because she hears patients talking in the lobby. And so dijo, yo se la traje, Ms. Lopez, porque yo sé que usted le puede ayudar. And I looked at her foot, it was horrid. Anybody else would have wanted to amputate. So I look at it and I go, okay, well, you've been ignoring this foot, clearly. She had horrible ones and everything. Okay, well, can you come every day? And that's where we got experience. That's where we gathered the idea of seeing them daily for 5 days than twice a week. I saw her daily for 14. It took us 14 visits to heal out that foot that would have probably taken 6 months. So I said, hey, you know what, guys? We should front load all the visits. Why did I do that? Because she had a plane ticket that she couldn't afford to change, and I wanted to get her back to Califas, right, to California, by the time she needed to do that. So I'm like, then I did tell her, she was supposed to leave in a week. I said, can you give me like 2? She goes, cuando usted me diga, López, ya que me agarró confianza, she trusted me. So I debrided her every day, because she had a lot to take off. And debriding hurts. So number, take off the non-viable every day,